Well, good morning, everyone. Thank you all so much for being here today as we formally announce an organizational change, name change, and a refreshed branding that updates us from Enloe Medical Center to Enloe Health. I'm Jolene Francis, Vice President of Philanthropy and Communications, and it's my honor to welcome all of you here this morning. As part of our branding process, we also refreshed our mission, vision, and values statements, as well as adding new visual elements to our brand. And we believe that these refreshed brand elements more accurately reflect the size, complexity, and humanity of our locally governed, independent, nonprofit healthcare organization. Our President and CEO, Mike Wilchermuth, sends his deepest regrets. He could not join us today for this historic announcement. He is very disappointed by that. Unfortunately, Mike was tested positive for COVID this week, and he did give his permission to share that with you, so I am not violating any patient privacy laws. But I guess it is a good reminder and a cautionary tale that we are in cold, flu, and COVID season, so please update your immunizations, and please stay home when you are feeling unwell. As much as we will miss Mike, we do have an all-star lineup for you this morning. And I'd like to invite Enloe Health's Chief, I'm going to have to get used to that, Enloe Health's Chief Medical Officer, Dr. Sean Mairano, to the podium to make a few remarks. After Dr. Mairano concludes, we will hear from Enloe's Chief of Staff, Dr. James Moore, and the Chair of the Board of Trustees, Denise Adams. Please welcome Enloe Health's Chief Medical Officer, Dr. Sean Mairano.
You can appreciate it. I was really excited to find out that I was doing this when we heard Mike unfortunately had COVID. Well, thank you. Good morning. Thank you all for being here this morning. We are honored by the support we receive from the community we serve and humbled by your presence here today. The organization has been recognized by several names over the century here in Chico. Enloe Hospital, NT Enloe Memorial Hospital, and more recently Enloe Medical Center, all of which reflect the identity of our founder, Dr. Newton Thomas Enloe. The Enloe name has meaning in this region and garners respect not only locally but nationally in our industry. We also enjoy strong support from our community, and that is something that we are truly grateful for. From the beginning of this process, we knew that the Enloe name would be the anchor of this brand. Enloe has grown and evolved substantially, particularly over the past 10 years, particularly in the aftermath of our campfire in 2018. We've worked hard to fill healthcare gaps throughout the community, realizing there was destruction of nearly 30% of the county's healthcare infrastructure at that time. Much of the work involves services not only within the hospital but outside the scope of the inpatient setting. We've greatly increased the number of offerings of our outpatient care in this region. Today, we have a robust healthcare system. We remain strongly independent, and that is something we're all very proud of. Choosing a name that reflects the scope and scale of the organization makes sense at this time in our history. We also wanted something in our community that we could relate to and be comfortable with, and that name is Enloe Health. Our commitment to the region we serve is reflected in our updated mission statement as well, elevating the health of our communities. We want to point out that communities is plural intentionally. As a regional healthcare system, we serve many communities in the North State. But in this case, in addition to the community we live in, we're also referring to the communities that we all belong to. Our family communities, our neighborhood communities, our social and faith communities, and the communities that we all serve both professionally and through service. In this sense, our mission is to elevate the health of all communities within our area. Our vision statement has also been refreshed in our vision of delivering exceptional healthcare experiences. It gives us an opportunity and inspiration to strive to provide our region with exceptional care, delivered in an exceptional way with each patient interaction. I'd now like to introduce Dr. James Moore, our Chief of Staff, to share our newly restated organizational values. James.
Following that short drink of water, I'm going to raise the microphone here. Thanks, John. Good morning. Pleasure to be here today. As a physician working in our very busy emergency department right over there, I'm happy to be able to share with you our restated values that guide our work every single day here at Enloe. These statements act as the touchstone on which our culture at Enloe Health is built. At Enloe, we value number one, safety. Safety, for us, that means embracing the shared responsibility of safety for everyone. Our patients, our visitors, our staff, physicians and volunteers, everybody in the organization. Safety is our number one value. Secondly, we value engagement. By empowering our active participation and ownership of the results. At Enloe Health, every voice matters and every opinion matters. Striving to provide the best patient care requires us to show up, speak up, and actively participate in every aspect of our work every day. Third, we value trust. For us, that means fostering trust with competency, character, and honesty. That goes across the board from physicians, staff, and our patients especially. We also value excellence. And we do that by relentlessly pursuing innovative improvement. It's no secret we've been doing that for years and years, which is what got us here in the first place, right? We will continue to pursue this process through improvements, through innovation, while at the same time keeping patient safety and satisfaction at the forefront. Final value, and perhaps the most important, is the concept of belonging. At Enloe Health, this means cultivating an environment of belonging with compassion, acceptance, and respect, no matter what your background is or what you're striving to achieve individually. Thanks. And now, I'd like to invite the chair of our Board of Trustees of Enloe Health, Denise Adams.
Good morning. Thank you once again for being here this morning. We're really honored that you took some time out of your day to be here, so thank you. As chair of the Enloe Health Volunteer Board of Trustees, I just want to say how incredibly proud I am to be affiliated with this organization. After 110 years of serving Chico and the surrounding communities, Enloe has grown into a comprehensive healthcare organization focused on safety and service, and always known for its high quality, compassionate care. For the last 3 years, Enloe has been named one of the 250 best hospitals in the country for patient safety and satisfaction by Health Grades. And that is something that we can all be incredibly proud of. Under the shared leadership of administration, our medical staff, and the Board of Trustees, Enloe continues its work to meet the growing needs of our region. And that work is done with the patient at the heart of every decision. The new name of Enloe Health represents the complexity of services offered while continuing to reflect its status as an independent, locally governed organization built with the best interests of the region in mind. With the new name comes a new icon, a symbol that honors the organization's past and celebrates its future. The new icon offers a unique and contemporary look and was derived using a historical photograph of Dr. Newton Thomas Enloe. I'm honored today to join Dr. Myrano and Dr. Moore as we unveil the first public signage representing this important milestone in Enloe's history. Thank you again for joining us today and participating in this important occasion.
3, 2, 1.
I want to thank you all again for coming this morning. It means a lot to us that you would come. We want the community to know that this new update is going to take about 18 to 24 months to accomplish across our campuses and across the entire organization. So we are grateful for your patience as we begin to roll out this new signage. We hope you like it as much as we do. It's going to take some time, but we're going to get there. Thanks again so much for coming this morning to this historic announcement. Pleased to see you all. Have a great rest of your day.